Hello, everybody. Just want to make a quick comment about back pain because I keep getting reminded every day of how significant this problem is and the things that people will go do to address back pain, solely back pain. I'm Melissa Cady, the Challenge Doctor, and I'm talking from personal experience as an anesthesiologist, as someone who's board certified, fellowship trained in pain medicine. And I see lots of people pursuing many interventions for back pain, specifically back pain that doesn't really have any functional limitations other than pain itself. And for those that have isolated back pain without any pain going past the knee, or as far as shooting pain down the knee to past the ankle to the foot with a definitive nerve pain or neuropathic pain or what's called radiculopathy, or other bowel and bladder issues, and no specific trauma as far as like severe high impact, or no other suspicions for cancer or infection. The typical nonspecific back pain, which is the predominant form of back pain. And so I see a lot of people taking on huge interventions, including unbelievable fusions of backs just for back pain. And I just had to get this out there again and tell people, please get help with people that are experts in pain. Go read Explain Pain, understand pain and all the things that contribute to it. Where you feel the pain doesn't necessarily mean where the problem is. And you need to become educated about pain because most physicians have no idea the real neuroscience of pain, because this is really more of a last 5 to 15 years of accumulated knowledge, and it's there to protect you. However, sometimes we have hypervigilant systems and they're trying to look out for us. And unfortunately, we interpret that it means that something is damaged and needs to be fixed. And the reality is many people are getting these interventions that are not taking away pain, which means they typically pile on all the things they did before, including opioids injections, and people are getting surgeries, yet they're still going back to these injections and medications, and there's plenty of studies showing that less than 10% get off of the opioids after the surgery. So I implore anyone going to deal with back pain to get help from people that are conservative initially. They'll know if there's a red flag or a concern to send you off to a surgeon. However, surgeons are not necessarily dealing with all the components that can contribute to the whole experience of pain. It's way more complex than most of us have been trained initially about. And just because you went to one physical therapist doesn't mean that you've tried all conservative management. There is a lot of different ways of going about it. The thing is, it needs to be personalized to you, and everyone's pain experience is different. I know how debilitating it can feel, but even a small little cut from some other injury that's a direct injury can be incredibly painful too. So the back pain itself is not necessarily meaning you're harming yourself, and I have spoken to multiple people just recently that think they're going to hurt themselves by walking or doing some other activities, and our body, our spine is resilient. It is strong unless you've had trauma or surgery you need to heal from. That back does not need to be stiffened and worried about. We need to actually be more comfortable and try to understand the pain. So I implore people out there, I just had to get on live and remind people, you need to realize that you have to understand your pain better, and just going to cut on it doesn't mean you understand it. Unfortunately, it's an attempt to fix something that doesn't necessarily need to be fixed, because there's a lot of normal aging changes that we assume have to do with the pain. So please educate yourself. Get Explain Pain. There's lots of other resources, but Explain Pain and some of their other painful yarns, and also the Protectometer gives you an idea of all the potential inputs from your life that could be contributing to your pain. I wish you all well, and to remember to challenge your health before your health challenges you. And remember, your back, your spine is strong. Get out there and move, and don't be afraid. I'll talk to you later. Bye-bye.